Thank you for staying tuned to NewsMakerLive with Laura. I'm a little raw in my throat right now because I am so disheartened, I suppose, of the state of our country, and we're only in the second month. And I remember last year when we were so elated that 3 months had passed with not a murder. This year we're not so fortunate, Last week, was it last week, or it's been 2 weeks already, I think. I met a young lady, and in speaking, I found out that she was a nephrologist, and a nephrologist is a fancy word for a medical doctor who specializes in kidney care and treating diseases of the kidneys. And we had a little chat, and in speaking to her, I realized how important our kidneys are to us, and how many of us don't have the luxury of having functioning kidneys, and how many of us more are unsuspecting or unwitting victims of kidney disease. The sad thing about kidney disease is that it can get to the latter stages before we begin to see symptoms. And so I thought, since March 9th would be Kidney Awareness Day, and March would be, for medical doctors at least, a month where they're observing kidney health and all of those things. And being that St. Lucia has one of the highest rates of diabetes per capita in the world, I thought I should invite this young lady to our studios to talk to us about our kidneys and the health of our kidneys, and in particular the kidneys, but other issues that the St. Lucia Medical and Dental Association will be dealing with in the coming weeks. So joining us this evening is Dr. Merle Clark. Welcome, Doctor.
Thank you. Thank you for having me.
Great. March 9th is World Kidney Day. Tell us about your association, the St. Lucia Medical and Dental Association, and then segue into what is up with World Kidney Day and what you have in store for that.
Okay. The St. Lucia Medical and Dental Association is a professional body of doctors and dentists in St. Lucia. We have as a mandate, it's been in existence for quite a few years, since 1962, started by Dr. Owen King and Dr. P.A.W. St. Rose and a few other physicians. And it has been in existence, perhaps not very, very visible, but it has been in existence. And we have as a mandate essentially the protection in part of the general public, ensuring that we educate the public on matters of health, matters of health and wellness and disease, in fact, because if you know what could happen if you have a particular disease, then you understand the importance of preventing it in as much as possible. And that basically is the mandate of the St. Lucia Medical and Dental Association, of which I'm the vice president. Before we branch off into kidneys, which is principally what I'll talk about today, just to mention a few of the activities upcoming, because March 10th, actually, the second Thursday of March of every year is observed as World Kidney Day, and that will be March 10th this year. But February is generally observed as Heart Month by the American Heart Association. And heart disease, kidney disease is very important, but heart disease does remain the leading cause of death in the world. In women in particular, one of your topics, women and the wellness of women. So heart disease remains the leading cause of death in women. And this month is being observed as Heart Month. And the St. Lucia Medical and Dental Association thought it necessary not only to increase our visibility, but to take a bit more seriously our mandate of educating the general public, because we always say a healthy nation is a wealthy nation. Because what we're seeing is a lot of patients in the prime of their lives succumbing to heart disease, and certainly that needs to stop. What we need, just like kidney disease, which is an independent risk factor for heart disease, because you can't speak of kidney disease without speaking of heart disease. You can't speak of heart disease without speaking of kidney disease, because one thing leads to the other. With the cardiorenal syndrome, it's an unholy marriage of what can go wrong with the kidneys and the heart together. For the same reason, you can't speak about them without speaking of diabetes and hypertension. Right. So those are things certainly we feel the need to educate the public on, because in as much as some people know and you do some educating, we perhaps aren't reaching enough people. So we certainly recognize the need perhaps to go out in their community a bit more and meet with people, such as is being done by the group of which you're part of, and Miss Catherine Seals is a part of, that you go out in their community, the grassroots, with a one-on-one, and people certainly respond a lot better to that. So in part, that is what the SLMDA is looking to do this year with Heart Month. And as part of that, on Saturday, we are having a grand ball, a gala, at the Sandals Grand. It will also be our awards evening, will also be held on that day under the patronage of the Governor General, Dame Paulette Louise. And that is really for Heart Month. We're also going to be launching a foundation, the Give a Heart Foundation, on that day. And the Give a Heart Foundation, the aim of it is to do just that, to allow for funding, to do more educating, to go out into the communities more, and to help our people. We recognize that to whom much is given, much is expected. And we do plan to do a lot more of that than perhaps we've been guilty of not doing in the past. Okay. So that's about the SLMDA.
But before we go on, you mentioned heart disease, and I begin to, oh my God. You know, I mean, I'm a big girl. So I would be a poster child for a few of our non-communicable diseases, such as diabetes and hypertension and, you know, a host of other things. We know that hypertension, and coming up to the studio today, I was listening to a news clipping on hypertension and the slew of side effects. You know, it's a silent killer. Yes, a complication. Complications. It is a silent killer. It comes in, you don't even know where, and it could have
a danger of it.
Right. Talk to us a little bit about diabetes and hypertension and how these two killers could lead to kidney disorder and heart disease and that kind of thing.
And you rightly call them killers, because that's what they are, silent killers, because unfortunately in the beginning, when it's early and something can be done, they cause no symptoms at all. With diabetes patients, I say the lucky ones, perhaps may have a slew of symptoms. There is the urinating frequently, yet you're feeling thirsty a lot, weight loss, interesting enough in some patients, and that there are different types of diabetes. Diabetes has quite a few classifications, but type 2 diabetes, which is the type which is most prevalent, the type we see more in our adult population, the type we see more generally, these are the symptoms you could get initially. Somebody who has what we call polyphagia, you eat a lot, you urinating a lot, and a series of other symptoms, is the leading cause of kidney disease, and also one of the leading causes of heart disease as well. Hypertension, on the other hand, is perhaps even more silent, because you would feel absolute, at least with diabetes, you may or may not get some of those symptoms. With hypertension, you would feel absolutely nothing. So it really is the classic silent killer. Especially us black people. You would find, for example, perhaps Caucasians would come in, and it's important that we always tell patients, you need to know your numbers. You need to know your blood pressure, what it should be, just like you know your age. Right. So you would find a Caucasian person perhaps coming in with a blood pressure of 140/90, and they're very symptomatic. They have headaches and feeling unwell and that kind of thing. So you find we perhaps would diagnose them a bit earlier, whereas we would see, and I think every doctor who works in the emergency room and even doctors who work privately could attest to that, patients coming in with what we call stroke blood pressures, and blood pressures which are sky high, and looking at numbers like 260/120, whereas your normal blood pressure, now the Joint National Committee on Hypertension, which is an expert group, which tends to give guidelines as to what blood pressure should be and what we should use based on the patient. We individualize the treatment, has said that blood pressures, I think historically everybody knows 120/80, 120/80. And that is still an ideal, but for your blood pressure to be under 120/80, but it's acceptable to be under 130/80. So when you're looking at what is acceptable and what some patients coming in and are feeling completely normal, because a patient may come to you with something else. Perhaps I have a urinary tract infection. Perhaps I have a cough, I'm chesty, something that, and you check the blood pressure, as we do routinely at the offices and at the hospitals. And those patients, that's how we are diagnosing quite a few people. They're the less fortunate ones who come in already with a stroke, already with a heart attack, already with end-stage kidney disease, and that is when the hypertension is diagnosed. And at that point, it is too late. It's too late to do something. I'm not necessarily saying that those patients are going to die, but certainly the odds of death are a lot more than a patient who does not have one of those chronic non-communicable diseases. So hypertension really is a silent killer, and it is important that people get their blood pressure checked. So unless your blood pressure is checked, you're not going to know you're hypertensive. And it's unfortunate that we have patients with a strong family history of hypertension, and yet they've never had their blood pressure checked. It really is.
At what age or at what point should one
start checking?
Look, yes, because I mean, I've always known my mom to be hypertensive. She became hypertensive during her first pregnancy,
right?
Which was, I mean, in her early 20s. So she's always had that. But I never even thought that it could perhaps pertain to me, because I never intended to have kids in my 20s. So I was like, that was why mommy had hypertension, because she...
So I'm okay.
Yeah,
I'm okay.
You know, I'm okay for a while.
Yes.
Maybe I should start getting worried when I get pregnant, you know. And there are a lot of us who are like that. We live in this cocoon and we're unaware. Right. So at what age or at what point do you really need to start thinking of your blood pressure and really taking it seriously?
There is no set age at which you need to start checking your blood pressure. There really isn't. But the earlier, the better, because there are, even in pediatric children, and we do have a little girl in Vieux Fort, for example, who has kidney disease, and we're certainly going to be advocating. I'll talk to you a little more about that a bit later. Kidney disease, for example, usually manifests with hypertension, because hypertension causes kidney disease, the second leading cause of kidney disease, second only to diabetes. And kidney disease leads to hypertension, so it's a vicious cycle.
Oh, wow.
Damaged kidneys cause high blood pressures damage kidneys, and it's very difficult to control blood pressures in patients with kidney disease. So you would find patients, for example, on 5 drugs, and nobody likes to take tablets. But you've had to take 1 multivitamin and not had to take it. So when you have a patient on 5 drugs, just to control their blood pressure, the compliance with that is very low. So what you find is that you don't have control of the blood pressures, and that leads to more complications, the heart attacks and the strokes and the kidney disease. So it really can be a very difficult thing to treat. That being said, you can have children as young as 4 and 5 with blood pressures which are high for their age, or high for their age group, or what you call their percentile. So if, for example, you're one of those patients, and luckily some of them would manifest with other things. Children tend to develop, for example, with kidney disease, tend to have something called nephrotic syndrome, where you have...
Break that down.
You have nephrotic syndrome. Whenever you hear the word nephro or NEPHRO, that relates to the kidneys. And when you speak of nephrotic syndrome, what you basically speak of is a syndrome whereby what triggers it is the kidney spilling, someone spilling a lot of protein from the kidneys, so via the urine. So kidneys, when you're spitting a lot of protein, there tends to be a characteristic foamy or frothy appearance to the urine. So we do ask patients to check for that sometimes, but those children sometimes we present to the hospital, what the parents would observe is a lot of swelling. Their legs are swelling, they're swelling around their eyes, and they're just generally swollen, putting on significant amounts of weight in a short period of time. And that could be a clue that, in fact, that is always a clue that something is going on. And when you check their blood pressures, it can potentially be very high. Children also could develop something called nephrotic syndrome. For example, if they have a throat infection and that's not treated, later down the line, 2 weeks later, they can develop kidney disease. It's somewhat an autoimmune process where the body just attempting to fight off the infection. What you have is complexes forming, and that can deposit in the kidneys, essentially the same way that rheumatic heart disease is caused you can have that happening. So those children can potentially become hypertensive, and those more frequently are the causes of hypertension in young children. In somebody with
How prevalent is that though?
Nephritic, we don't see it as much anymore. We certainly are still seeing it, but because, for example, most people now, I think, I shouldn't say most, we still have a lot of patients not necessarily going to the doctor. Even if they're feeling unwell, I can deal with this, it will go away. But throat infections, for example, which are in terms of the pathophysiology or how you have nephritic post-infectious glomerulonephritis happening, you need to have a throat infection first. And admittedly, most children are treated for their throat infections now, so you don't have that downstream effect on the kidneys. In terms of nephrotic syndrome, it is not very, very common in terms of an actual number of patients or percentage of the population. I can't give you that. We don't have those statistics as such, but you do see it ever so often, children presenting with nephrotic syndrome. But most children, admittedly, who have hypertension or high blood pressures, it probably won't be as high as the adult blood pressures, but most of those children have underlying kidney disease. But you have teenagers, 15-year-olds and 13-year-olds who have high blood pressure. And for example, if they have lupus, especially young women who tend to develop lupus a lot more than men, 9 to 1, you can certainly have, or children, younger people who develop what we call primary glomerulopathies, again, the kidneys, those people can have high blood pressure, which is why when a younger person presents with high blood pressure, we usually have to investigate to find a secondary cause. What is causing this blood pressure? Usually the answer lies in the kidneys. It can lie sometimes in the thyroid gland and a series of other things, what they call endocrine issues, but it usually lies in the kidneys. In the adult population, anybody over 18 really, or even a bit older than that, usually the cause of hypertension is what we call essential hypertension. 95% of cases, the cause of it isn't clear, and those are the people with a strong family history of hypertension. So like your mom, you said, she developed hypertension during pregnancy, and that could happen. In fact, there is something called preeclampsia, which can lead to something called eclampsia, which is a more severe case of hypertension in pregnancy, where patients could have seizures and a series of things. But a patient who has had preeclampsia, their first-line relatives, and there are, again, risk factors for preeclampsia. It's not exactly clear why it happens, why the blood pressure starts going so high after the 20th week of pregnancy. It is thought to have to do with the implantation of the placenta. But if you have your first-degree relatives are also at risk, potentially. We're not saying necessarily that they will develop it, but there seems to be a certain degree of risk for the relatives to develop preeclampsia as well.
But this is a lot. No, it really is a lot, and I think I have the capacity to take in a lot, but it is a lot for me. So I can just imagine how much it is for our viewers out there who are trying to follow.
Right.
So we're using a lot of fancy words, and we're trying to break them down, and we have a lot to fill in within the space of time that we have. So it's going to be a lot. But I am really concerned. Like when I started researching for this show, and I started talking to you about the issues,
Right.
it never occurred to me that it could potentially be so huge, so big a thing,
Absolutely.
especially in delinquents and children, you know. One of the things that you said is that really struck me and resonated with me is that a lot of the times we don't go to the doctors, we don't visit the doctor, so we have a sore throat and we decide, okay, we're going to take care of it on our own, or we're running a little temperature and I'll just drink some bush medicine, or our child has a little fever or something and we take care of it at home. A lot of the times it's because we really can't afford the healthcare. Healthcare is prohibitive for a lot of us. So in this regard, is there anything that the St. Lucia Medical and Dental Association have in place where you guys can do pro bono work? I know in legalese for lawyers it's called pro bono, but I don't know what you right, what your doctors call it when you do it for free. Have a clinic where maybe on a Saturday you can volunteer your time. Is there anything like that?
There are a few doctors who do it. Dr. Jenny Stanley, for example, has been running, again, she's a cardiologist, a clinic for years and years and years, and it's completely pro bono. There are other physicians who do it. And it is, again, one of those things that the SLMD is certainly looking at, having a more structured manner, that more people are aware of it, that this clinic is going to, because we completely aware healthcare is expensive, not just here. It's prohibitive for many people in many places, which is why the issue of Obamacare, for example, becomes so important, the importance of having health insurance, because healthcare is expensive. And it's certainly something we are looking at. And with time, as the year goes on, we will inform you where those clinics will be and when we start in which physician. But there have been initiatives to start it, but everybody tends to be very busy sometimes. But certainly we're going to make a more concerted effort to do this. This executive of the SLMDA, we're certainly a lot more enthusiastic again about giving back and our and the family and community, and that is certainly something we're going to look at. It's not on stream yet in an organized manner, but as I said, there are physicians as we speak who do a lot of pro bono work.
I remember as a child growing up, going to school, every I almost said fall, but the major term, so in September,
Right.
for the September school term, we would have doctors and nurses come in and give us our shots and take our
Right.
blood. And I don't remember our blood pressure being taken,
No.
but maybe that's something that we should look
We
into,
should institute.
considering our sedentary lifestyles and the
Exactly.
fact that we're always on a
Exactly.
phone or always on a console and not necessarily outside running and playing and getting that kind of
Very
activity.
happy you're bringing up the children now and the schools, because again, not only the SLMDA but the St. Lucia Renal Association, it is something we recognize that we have to do. You have to get into the schools, because when children know information, they tend to talk a lot. They talk about it at home, and this happened at school, and then the parents tend to listen. So we recognize the need to get to that age group. When Kidney Week this year, World Kidney Day, the theme is all about children. It's kidney disease in children. Act early to prevent it. And the American Society of Nephrology and the International Society of Nephrology recognize that need to involve the children more. And that is why that theme was chosen. So in terms of our activities, and I'll preempt you a little bit, for Kidney Week this year, part of the activities that we have is we've launched a primary school's essay competition. And that simply is a way of getting the children more involved, getting them to do more research, the importance of your kidneys, because the topic of the essay is that, the importance of my kidneys to my health. And we believe that if those children are able, so the primary school children are more involved and they do some research and you understand those kidneys that we take for granted, that you hardly ever think about, how important are they, then I think we would have a better understanding and of what is going on, the importance of the kidneys, as I said, and we won't have such a big problem in the future, because we do have a problem as it stands with a lot of patients having end-stage kidney disease and late-stage kidney disease. And if you think the cost of healthcare generally is prohibitive, the cost of providing renal replacement therapy, which in our setting is dialysis, for those patients is indeed prohibitive. It is extremely expensive. So we need to stop that tide of patients coming in with end-stage kidney disease, and we do recognize the need to start from the little ones. And that is why we're doing those programs this year. We certainly plan to go to quite a few schools, and not only checking the blood pressure. We do need to start doing blood pressures, but also testing urine as well. It is something I think even us as physicians tend to overlook sometimes, the testing of urine, because it is so important. There's a lot that your urine can tell you, because everybody just goes and I'm going to pee and that's it. But there's so much, nobody even looks at it. You'd be
I
amazed
know.
the number of patients I ask.
Amazing.
What your feces? No, but it's yours. You're supposed to look at it. So
I
any
know.
change, yes. So
Because
that-
I say to my friends, like sometimes I say, oh my gosh, today my pee was really yellow.
Exactly.
And they're like, huh, that's just gross. And I'm like, no, I
No.
need to know, because usually it's very clear. So when
Absolutely.
it's very yellow,
You detect
I
it
need to know
different.
why it's.
You will be
you know?
amazed at the number of people who do not do that. And it is important that people do that. You need to know yourself. So if anything is awry, then you recognize that early enough. And we also need patients to see their physicians earlier. When you're feeling well, you need to see your physician. So if anything is going wrong, it's detected early. And in medicine, anything detected early is usually a lot cheaper to treat, it's a lot easier to treat, and the results, the outcome is probably going to be a lot better. So it is important that patients do that. But back to the schools, not only do we plan to do blood pressures, we also want to test urine. Because as I said, when you do normally on a year, the St. Lucians who actually do their physicals, and that's still quite a few of our people who actually do a yearly physical and get your blood test done. Yes, guilty. And that is so important. Sometimes we overlook the urine. And it is quite possible in the case of kidney disease, for example, that your blood tests look completely normal, but in your urine, they're detectable, there are different protein or epithelial cells, so I know that may be hard to understand, but a series of things that we look for in the urine that should not be there. And that could be detected very early. Even when your blood tests are completely normal, you are feeling perfectly well, your physical exam is perfectly normal. So I can't stress enough the importance of having your urine tested. And if your doctor won't do it, just remind them, hey doc, I'd like to have my urine tested.
And that can be done at any age, at any stage.
That can be done at any age. Absolutely can be done at any age.
The thing for me is, I'm not a mom, but I often think like a mom.
You're right.
I would love my kids to have a youth. Like, you know, a childhood. Yes. I don't want them to have the, oh my God, I need to check my blood pressure, and, you know, and whatever. So I don't want to have them to be burdened, because I certainly wasn't.
But it's actually
with all
fun
of those
for
things.
them. You weren't, but it's fun for the children. If you decide to check your blood pressure, you see how excited they are to come sit in the chair and have their blood pressure tested. And this certainly is not something you're doing every other day or every week, perhaps once a year, if that often, especially for children. For adults, we certainly recommend for healthy adults, and a lot of people are assuming they're healthy. And I always say, you don't assume you're healthy. Know for sure you're healthy. Get tested. Do your HIV test. Test your urine, do your kidney function, your liver function. It's infinitely cheaper to get those things tested. And if something is going wrong, have that detected early than it would be to treat it later down the line when you're dealing with end-stage organ disease. Okay, so we're due for a break, and we've talked a lot. We've had a lot of information thrust at us, and we've talked about, you know, the typical kidney problems stemming from hypertension and diabetes and the vicious cycle that surrounds it. When we come back, I'd like to talk a little bit about polycystic kidney disease, because that's something for me, until last year, I didn't know anything about. So when we come back, more on kidney disease with our guest, Dr. Merle Clark. See you on the other side of the break.